Hi everyone, it's Suzanne and today is my 17-week pregnancy update. So I'm 17 weeks and 3 days pregnant today. The baby at this point should be about 13 centimetres long, so about the size of an onion, and it should be blinking and sucking its thumb at the moment, so still lots of developing going on. This last week I had my 16-week pregnancy appointment with my midwife, which went really well. She was really lovely. It was a different midwife to the midwife that I had when I had Reuben, because she's currently off sick, she's quite poorly, but the new midwife was lovely and we talked through some of my symptoms that I'd been having, so dizziness, which she said was, could be to low blood pressure, and just to eat and drink regularly and keep my blood sugar levels up. I also mentioned the numbness that I was getting in my toe, and she said the baby could be lying on a nerve, and so that could be causing the numbness, but she said if I have any problems or it gets worse to go and see the GP. She tested my urine and that was all fine. She looked at my notes from the consultant appointment that I had to check out my thyroid, and she marked down kind of the next blood test that I have to have and the levels it needs to be within. She looked at my Down syndrome result, which was kind of low risk, so she just put that in my notes. She then did a blood test for my rhesus negative test. So I think I mentioned this in a previous vlog, but my blood group is B negative. So that means normally any rhesus negative mums would have anti-D at 28 weeks, and that's just in case that your baby is a positive blood group and your blood mixes. But where I live, they're doing a pilot whereby they take a blood test from the mum at 16 weeks, just a normal one in your arm, and luckily she did it first time because I've got really small veins and sometimes it can take like three attempts to get blood, but she did it first time, which was good, and my son was sitting on my lap, so it was all a bit nerve-wracking, but it all went fine. And what they do then is analyse your blood, and some of your baby's DNA gets in your blood, so they're able to tell the blood group of your baby. So if your baby is also rhesus negative, then you don't need to have anti-D at 28 weeks, which is really good because anti-D is a blood product injection, so basically you're getting someone else's blood into you. So if you don't need to have it, it's quite a good thing, but the test could be inconclusive or your baby could be rhesus positive, in which case then we would need to have the anti-D at 28 weeks. So we did that. And then she laid me on the bed and we listened to the baby's heartbeat, so that was lovely. She did give the caveat to say that if she couldn't find it then they wouldn't do anything about it or worry, because it's sometimes difficult at 16 weeks, but she was quite old-fashioned and she liked to do that. So, but she found it straight away and it was 158 beats per minute. So the appointment was really lovely and it was really good to meet this midwife, and hopefully I'll see her for the rest of my appointments, but I don't have another one until 28 weeks, so quite a long time to wait for the next one, but that's because I'm a second-time mum. So my weight this week was 132.8 pounds, so I weighed myself on Friday when I became 17 weeks, so that means I've put on 1 pound since last week and a total of 10.8 pounds since the start of my pregnancy. So kind of a little bit more than I'd hoped, but still fine, and I feel fine. And I have had more hunger this week, so I've been eating again quite a lot, so I think the baby might be having a growth spurt, but I think it's all fine, so I'm not worried about that. And my belly was 36 inches, so that was just the same as last week, so no change there. I've just got my notebook here, so I'm just reading as I go along. My sleep has been good, actually. I've been going to bed a little bit later because I've not been so tired, so this means I can generally not go to the toilet in the night and just go when my son wakes up about 6 o'clock. So sleep's been really good actually, and the weather's cooled down. You might hear the wind, it's quite windy and rainy today. So yeah, that's all fine. Movement, it's been really exciting this last week, so I'm generally feeling movement every day now, and it's not just flutterings, it's like proper movement. So I'm feeling it a lot earlier than I did with my son, so I don't know if that's because it's second time round or because my placenta is in a different place this time, but yeah, it's really nice and really reassuring. So loving that feeling, it's just amazing. I can't wait till I can feel the baby hiccup. My son used to do that most nights when I went to bed, and that was just a lovely feeling, so I'm really looking forward to be able to feel that. I haven't really had any cravings this past week, just been eating normal diet and a few cakes here and there, unfortunately. Purchases, I bought a couple of books. So I bought the Gina Ford Contented Baby and Toddler book. So I'm not going to go into too much about Gina Ford because I know some people love her or hate her. I just generally read between the lines, and I find it useful to have some kind of idea about how long the baby should be sleeping and when they should be feeding, but I don't follow it strictly, and I don't have showers when she says to have showers and things like that. But I just find it good to give myself kind of a rough routine to base things around, so I just wanted to get a bit prepared and do a bit of reading before the baby arrives and see how we can manage looking after a toddler and a baby. But nothing else this week, so no clothes or anything like that. So today I'm wearing a t-shirt top from New Look that I bought a few weeks ago that you'll see in one of my videos. I'll show you properly when I do bump shop. And just some denim jeans that I got from Next in my last pregnancy, so I've taken them out and I'm wearing those again today. So this coming week I'm looking forward to seeing some family, so I'm going to stay with my mum at the weekend. So me and Ruben, my husband's away, so we're going to go and see my mum. So Ruben loves his grandma, so that'll be nice. I'm really looking forward to that. Also getting my oven cleaned professionally this week, so been meaning to do this for months and months and months, but I've started a to-do list of all the things I need to do for when the baby arrives, and this is one of them, so I'm just going to get it ticked off the list. So trying to get a little bit organised. And yeah, just carrying on with the wardrobe. So I thought I'd film this video in front of my wardrobe to kind of give me inspiration to finish sorting it out. I've done the 2 bottom drawers, I need to do the top drawer and the shelf and then the hanging rail, so still quite a lot to do, but I'm kind of progressing with it slowly. So that's it for my 17-week update. If you've got any questions, leave them below and I'll answer them in my next video, and I'll just do a bump shot now. Okay. So this is the bump. Hi. This is the bump from the front, from the side, and from the side. So that's 17 weeks. I'll see you again next week. Bye!